Ladies and gentlemen, I bring with you greetings from my institution, St. John's Medical College in Bangalore. I just generally uh, sort of unlock my video just for a couple of minutes to actually say hello to you and to show you that this is not a computer but a human being speaking here. Welcome to this session. Thank you for those kind words of introduction, Dr. Lograj. With that, let me begin with the topic for today, which is OSCE, an introduction to OSCE. Well, I'm calling it an introduction to OSCE, but I'm sure in some way, many, or in fact, most, or in fact, all of you might have used OSCE as part of your evaluations. So what I'm doing here is to just try to bring to the table a common understanding of this topic. And we have, in my department and my institution, used it occasionally, or actually now pretty regularly in some of our programs. And I find that it does provide an interesting aspect to evaluation, but we will see as we go on to assessment and evaluation. So my objectives for today are these. I mean, all of us, of course, will start with what the abbreviation OSCE stands for, which Dr. Lograj very kindly said. We will also understand a little bit of the background from where this OSCE concept comes and how we will actually organize an OSCE session in our institution, and end by looking at what some of the strengths and weaknesses of this system could be. At any point in time, I guess if there are technical issues with the audio or the video, or if you think that you need to ask a question, I guess you will raise your hand. I request Dr. Lograj and his team to moderate, and we perhaps will have questions at the end if you do have some. So with that, let me plunge into the topic for today. Now, I must come from the perspective of evaluation itself, which is where this session is located. And when we say that we want to evaluate or assess our own input that we have given to a student or a group of students, we really mean that we want to measure the extent to which the objective that we had at the beginning of our session actually has been attained. So for every educational session, like I keep telling my postgraduate students and faculty, we must be driven by an objective. We must be driven by some purpose which we are trying to achieve at the end of that session. And I tell them the purpose is not actually to take the session. That is not the purpose. But the purpose is, having taken that session, what exactly have you achieved? And so evaluation of that session or that module will consist of seeing or measuring to what extent we have achieved that objective which we set out with. So now objectives, of course, in our healthcare setting, when we say we have an educational objective, we usually aim at improving ability in three areas. At the three conventional or the three classic areas of knowledge, where we have objectives in the cognitive domain, where we aim at increasing knowledge and also perhaps the ability to solve a problem using the intellect. And this is an objective which is placed in the cognitive domain. We also should have objectives aiming at the affective domain, where we try to convey an attitude. And for example, I tell some of my students who take a class, for example, if you take a class on tuberculosis, at the end of your class, of course, the student must be able to know what is tuberculosis, perhaps. What are the cardinal symptoms? How do you make a diagnosis? What are the clinical features? Of course, he should know that. But if you have an objective in the affective domain, that means by the end of that class, that student should feel, and I'm emphasizing the word feel, he should feel that tuberculosis is an important problem. In fact, he should get up and say, where is that tubercle bacillus? Let me go and fight it. Now, that is an objective in the affective domain. Oftentimes, not too much emphasis given to this kind of an objective. And of course, perhaps the domain which today's session will focus on, which is an objective in the psychomotor or the skill domain, where we try to get that student to be able to do something or perform a task. So in the cognitive domain, our evaluations are usually done by looking at the change in knowledge. Now, this is very classic, where we administer an essay question, perhaps. We administer an MCQ, a short note. These are all the ways in which we try to assess whether this student has the requisite knowledge, generally assessed in a theory exam setting. Theory exams could be of different types of questions, but generally we are assessing our objectives which are couched in the cognitive domain. But when we want to evaluate an objective in the psychomotor domain, we need to measure the skill of that student, or his or her ability to actually perform a given task. And like I said, today's session is couched in this domain. Now, tasks also are of different types, but I've taken the liberty to club them into three broad types of tasks which we do in the healthcare profession. Tasks related to clinical or practical procedures and examinations, like the examples I've written in this slide are to, let's say, draw blood or examine for the presence of an enlarged liver, or even measuring a blood pressure, or performing a surgical procedure, staining a slide. These are all abilities in the tasks related to practical or clinical procedures. There are also tasks related to communication, like taking a history from a patient, talking to a patient, counseling him or her, educating him or her. Now, that's also a task, and it is related to a skill which is communication. And of course, tasks related perhaps to interpretation and analysis. Like, for example, you give a student an X-ray and ask him to read it. Of course, there is a certain knowledge base which we assume here. So there is a cognitive domain issue here. But definitely there is also an interpretation and analysis skill involved here. So these, to go back, tasks related to procedures and exams, tasks related to communications, and tasks related to interpretation and analysis. Now, these abilities are generally assessed in the practical or clinical exam. Our university exams traditionally or classically have the theory and the practical. So the second set of tasks are what are generally assessed in our practical or clinical exams. Now, today's session, like I said, will focus on this. Now, as it exists currently, our practical or clinical exams usually has maybe a bedside clinical case presentation, a long case, a short case, maybe a laboratory-based exam, and other forms, perhaps, of tests, like a problem-solving test or an exercise, something like that. This is what classically we have at this point. Now, let's look at the practical or clinical exam. Now, what are the things that we are trying to measure there? We are trying to measure the ability of the student to take a history, in which case we are his ability in communication, and of course, a background of knowledge. But can he speak to this patient and actually get a good history? The ability to check for the presence of a clinical sign, which again is a skill, maybe an enlarged liver, maybe pallor, maybe looking for a cataract. And of course, perhaps the ability to perform a procedure, a lab procedure like drawing blood perhaps, or doing something else, right? Now, in doing this, three questions to my mind arise, very important questions when we talk about evaluation. The first question is, if our student has attained the objective, is there a good chance that this test or exam or method that we are using will actually recognize this? In other words, Let us assume this guy has actually attained the objective. He has got that skill. Then in that case, is our exam going to pick it up that he has actually attained that skill? And that is the attribute that we call validity. So is this method valid? For example, a long case presentation. Is it a valid method of assessing the ability to communicate, to interpret, and to analyze? Second, if two students have attained the objective to the same extent, does this test, exam, or method give the same result on repeated measurement? In other words, two students with the same level of attainment of our objective are presenting cases, and is it likely that they will get the same mark? In other words, is this method reliable? And lastly, is it only the extent of attainment of this objective that is being measured, or do other things influence the result of the exam? Now, you and me, having faced exams, having conducted exams, having had numerous students come in front of us, I'm sure understand what is the intent of this question. Is it only the extent of attainment, or do other things influence the result of this test or exam method? Maybe at that point, the mindset of the examiner or the circumstances in which this exam is going on. So this is what we ask, is this method objective? Right? So validity, reliability, and objectivity are important attributes of any method that we should use to assess the extent of attainment of an educational objective. And it is in this setting that we are discussing or presenting today the need for a system which we believe is valid, reliable, and objective to an extent at least, which is the objective structured clinical exam, or OSCE. And when we replace the word clinical with practical, we get an OSPE, objective structured practical exam. So our first question is, what is this objective structured clinical exam? So for us to understand the answer to this question, let's go over it in steps. The first step is the focus again on objective. Now, evaluation, we have said, is measurement of the extent to which an objective has been attained. Therefore, obviously, we must have a very clear objective if we want to have a clear evaluation. So I'm giving you an example of an objective which we will use for this session. A simple objective. The student must be able to diagnose and manage a case of hypothyroidism. It's a simple educational objective in the healthcare setting, right? So now, having clarified our objectives, and this is just one of probably numerous objectives that we have for our medical students or nursing students, right? So I'm just taking this one example and saying that, okay, this seems to be a fairly clear objective. At the end of this course or this module, the student must be able to diagnose and treat a case of hypothyroidism. Now, since we are now talking about the practical exam and not the theory exam, where we will assess knowledge, let us identify within this objective what are the practical aspects. Now, like I said, if the objective is to be attained, we do need to have a knowledge base which will be tested in the theory exam. Okay, that's fine. But in the domain of skills, we ask this question. And what is that question? If this objective, that is the ability to diagnose and treat a case of hypothyroidism, is to be attained, what are the practical or clinical tasks that the student must be able to do? So this is our next step. Having clarified our objective, we must identify which aspects of that objective have a practical tilt to them, right? So having identified this and using the same example, If that student is able to diagnose and treat hypothyroidism, he must be able to do the following tasks. And what are those tasks? For example, he must be able to take a history from a person who presents with symptoms suggesting hypothyroidism. So that's one task which he must be able to do. He must be able to perform a clinical exam, including interpreting response to the ankle jerk, which we know is delayed in a case of hypothyroidism. He must be able to investigate appropriately to confirm his diagnosis. And having confirmed it, he must be able to talk to the patient and counsel regarding appropriate management. Now, these are the practical aspects of that objective. The student must be able to diagnose and treat a case of hypothyroidism. Right? Now, there are several other tasks perhaps, but at least these 4 tasks he must be able to do. Now, our next step, having identified the practical aspects of our objective, we now have a limited amount of time in our practical exam. We cannot assess every single ability of this student to do every single task pertaining to every single educational objective. It's not possible. So we need to select out certain things which we can assess. So out of the 4 practical tasks, and I'll revisit those tasks, taking a history, performing an examination and interpreting the response to the ankle jerk, investigating and counseling, out of these, perhaps let us take this recording response to the ankle jerk. For today's clinical exam, let us choose this particular task as being the task that we would like to assess. Okay, having selected one task, our next step is to say, let's take that task which we have selected out of many possible tasks. We have selected this one, and let's break this task down into its constituent units. Now, for example, in the realm of a clinical exam, there are examiners. We have decided that for today, we are going to get our students to record the response to the ankle jerk because we want to assess that ability of the student. We believe that if we assess that ability of the student, we are assessing the practical aspect of this objective, which is diagnosis and management of hypothyroidism. Right? So if the student is able to record the ankle jerk response correctly, then what are the sub things that he must be able to do? He must be able to introduce himself or herself to the patient, explain the procedure, take that patient's consent, ask that patient to lie down, making sure that the lower limb is exposed below the knee, position the lower limb appropriately, which is flexed at the knee, everted and slightly dorsiflexed at the foot, expose the Achilles tendon, with one hand slightly dorsiflex the foot, strike the Achilles tendon with the rubber hammer, interpret that response, take leave of that patient, and thank the patient for their cooperation. Now, these are the sub-tasks of the broad task, recording response to the ankle jerk, right? So we have now broken the main task into subtasks, right? Now, actually what we have done is we have listed what we call the checklist for assessment of that particular task. So all tasks, like for example, recording temperature, recording blood pressure, performing a peripheral smear, can actually be broken down into a series of subtasks, which make up the broad task when correctly performed, right? Okay, now we have done that. What's our next step? We now assign scores, or what we call weights, for each of the subcomponents of that checklist. Now, our example is still response to ankle jerk. Now, for each thing that that student does as a subtask, we give some marks. For example, if he introduces himself, we give some marks, takes consent, give some marks, positions the foot, give some marks, etc. And we are also aware that certain tasks are probably a little more important than others. For example, positioning the lower limb flexed at the knee, everted and slightly dorsiflexed, probably is a little more important than expose the tendon. We may consider that that is slightly more important. So therefore, what do? We give that one a slightly higher score than the other one. So if he positions the lower limb correctly, we have given that a score of 5. So he's given 5 out of 5 or 4.5 out of 5. And if he exposes the tendon correctly, we say out of 2, he's given 2. Right? So this is how that checklist may actually look. So the broad task is written on top there, which is recording the ankle jerk response. We believe that we are going to give him or her 3 minutes time to do that task. It contains a total of 20 marks, and those 20 marks have been divided like this. For the introduction and explanation, it's 3 marks. For the positioning, it's 5. Exposing the tendon is 2. Dorsiflexing the foot is 2, etc., etc. Right? So this is an example of a checklist that we make for each of the tasks that we are going to actually assess in the practical exam. Now, having got like this 3 or 4 or 5 or 6 or 10 tasks that we are going to check, that we are going to assess among our students, our next step is to actually organize the place where we are going to do this. And OSCE is classically conducted in what we call stations. What is a station? A station is simply the site at which one particular task is being assessed on one given student. Now, stations also are of different types, depending upon what kind of task we assess. We just, classify stations like this. It's not that they are physically different, but they are of different types. For example, a history-taking station is a site where the ability of the student to take a history is assessed. For example, this patient complains of abdominal pain. Take a history pertaining to abdominal pain. That's the task which is given to the student. And that task is going to be conducted at that station. Maybe there is a procedure station, like our example of the ankle jerk response. That's an actual procedure. Here is a patient. Please perform the ankle jerk on him and interpret the response correctly. Something like that. There could be a communication station where we say, this is a mother of a 3-year-old child with diarrhea. Advise her regarding the use of oral rehydration therapy for her child. Now we are assessing how that student will actually communicate and counsel. And of course, there are response stations where we have a blood report or a chest x-ray. This is the chest x-ray of a 40-year-old patient with acute dyspnea. Interpret your findings and state 3 reasons for your answer. Right? And of course, in between, we put rest stations so that it's just like the spotters where we have blanks in between where the student can collect his mind a bit and perhaps have a cup of coffee. So in other words, these are 4 types of stations that we set up for our OSCE sessions, which are history taking or procedure stations or communication stations or response stations and rest stations. Now, what should be there in each of the stations? At the station, there should be an instruction to that candidate. For example, record the ankle jerk, measure the blood pressure of this patient, communicate with this mother regarding oral rehydration therapy. That's the instruction. Then the materials required by the student should be there. There should be perhaps a table, a chair, a couch, or a place, right? Maybe a knee hammer, maybe a blood pressure apparatus, something that is required for that task to be performed, what we call the materials required. Then, of course, there should be a patient. Now, if it is a history-taking, a communication, or a procedure station, then we need a patient. Now, how do we actually configure this patient? Now, if the task is take the temperature of this child, now we are looking at whether this guy can take the temperature. We are not looking at him interpreting it as fever or not fever, but we are just looking at the skill of taking temperature. In that case, we may not need to have an actual patient with fever. Even though it might be good to have one, it may not be necessary. So we use what are called simulated patients. Now, what's a simulated patient? A simulated patient is a person who acts like a patient who has a particular problem. So history taking, communication, these kind of stations can have simulated patients. But always remember, before we install a simulated patient in a station, we must train that simulated patient as to what role he or she is playing and what exactly he or she, his profile. For example, if I have a simulated patient for a station where a student is asked to counsel a mother, I must tell that simulated patient, look, for now, you are a mother of a 1-year-old or a 3-year-old child who has diarrhea. Child has had diarrhea for 3 days. Child has a little fever. Child is passing about 3 to 5 loose stools per day. Right? I mean, some background so that he or she gets into that role in order to play it for the patient or for the student. I'm sorry. So, like I said, we need an instruction, we need materials, we need a patient, and of course, sorry. Now, a task like examine this person's respiratory system, where we want to actually look whether the student can recognize an abnormal finding, like for example, rhoncus or a crepitation, we will then require a person who actually has that sign. So there we may need to use a real patient with a clinical problem, right? And the fourth thing that we need at a station is an assessor. Now, if the station is a procedure station, a history-taking station, or a communication station, that the examiner himself or herself can be the assessor, because direct observation has to be done. I mean, we've got to see for ourselves if this guy is actually doing each one of those steps which we have in our checklist. But in response stations where there is an X-ray or a blood report, we don't really require an observer or an assessor. There's just a paper there where the student writes down his or her interpretation and analysis. Somebody could be helping around to ensure that the student understands what he has to do, but they may not be a need for an assessor at a station like that. Right? So the time allotted for each task is generally uniform. Like the spotters, we generally say 1 minute to 2 minutes, but this is slightly longer perhaps because the tasks require a little more time. Some tasks may require shorter, some tasks may require longer, but we need to fix the longest period as the time required for every station for obvious reasons. Right? So the time allotted. So in summary, we must have a clear set of objectives. Out of those objectives, educational objectives, what are those which we are going to assess for today's exam? Let us say there are 2 objectives which we are going to assess, one to do with hypothyroidism, one to do with hypertension. Now, in these 2 objectives, we must identify the practical aspects in terms of what the tasks are which the students must be able to do if the objective is to be attained. Now, of those tasks, we must select the task for today's exam and then break the task down into subtasks, then assign scores for each of the subtasks and get the checklist for that task. Then we set up the stations for the OSCE, ensuring that each station has got the instruction, the materials, if necessary, a patient or a simulated patient, and if necessary, an assessor. And perhaps this is how it will look like when you actually organize an OSCE. This is how it probably looks like, where the student starts here. This is a history-taking station. There is a simulated patient, an instruction given, and there is an observer or an assessor because he's observing the ability to take history. This is a response station where perhaps there is an ECG or a chest x-ray or something where there is no need for an observer. This is a procedure station, like take the measure, the ankle jerk, or take a blood smear or something like that, where again there is an assessor, again a response station, a rest station, a procedure station, again maybe a rest station, response station, communication station, where we are looking at ability to counsel or to educate, where again there is an observer or an assessor, and again another response station. I mean, this is just an example of the how an OSCE can actually be organized. So again, to summarize, like I said, we start with what is the objective that we are going to assess for today's exam. For example, that objective is the student must be able to diagnose and manage hypertension. Okay? If he is able to do that, what are the practical aspects which he should be able to do? Well, he should be able to take history. He should be able to record blood pressure. He should be able to counsel regarding drug intervention and non-drug interventions as well. Okay, very good. So of these, let us select which will be assessed in today's OSCE. Perhaps we are going to select counseling regarding non-drug interventions. Now let's break this task down into subtasks and make a checklist. Maybe we need to see if he can first greet, assess the patient briefly, classify where this patient is, then of course say these are the non-drug interventions, classify them, reinforce, listen if the patient asks for a question or so, and summarize at the end. I mean, these may be our subtasks for this task of counseling regarding non-drug interventions. Then we decide what do we want. We want a well-lit station. We want two chairs, and we do need a simulated patient because this is a counseling station, and we need an observer who will actually assess on the basis of a checklist. Then we actually make the station, and we have one communication station. So this is just how we set up an OSCE exam, right? And note what are all the things we need. We need stations, which means that we need a large hall, perhaps with the ability for us to create some kind of cubicles. We need a lot of material. We need equipment. We need beds, maybe where patients may be required to be supine. We may need chairs and tables.
Sir, excuse me, sir.
Not audible. Dr. Sharmila, are you able to see the screen?
Yes, sir. Yes, sir. Now it's visible, sir, and you are audible, sir.
Sorry, I think we suddenly lost the link and I'm back. Okay, thank you everybody. Sorry for that small lapse. I'll continue from where I was, which is here. I mean, let me just go back here. This is where I was when we stopped, summarizing for an example of an educational objective with respect to hypertension. We were at the resources required. We need a large station. We need materials. And I was at the examiners and the patients. I was talking about the patients when we stopped. Uh, we need patients who need to be kept motivated because it's pretty boring for the patient to be spoken the same thing with each student. Simulated patients who need to be trained, assistants to help us to conduct this entire thing, evaluation sheets, checklists for examiners to mark on, for students to write on, student instruction sheets, timekeepers, bells, so many things that are required to set up this OSCE station. I'm just going back to that picture of the OSCE station. To set this thing up requires a lot of preparation. There is no doubt about it. It requires the previous day to be completely set apart to organize this entire OSCE station set. So, however, what do you feel about the advantages? Do you think that this is a valid exercise? Now, what do you mean by a valid exercise? Validity is the ability of this method to actually assess whether that student has achieved this objective or has not. That is the validity of in this case, the OSCE. Do you think the OSCE will actually be able to measure if a student has got the ability to record blood pressure? By doing an OSCE exam, will we be able to pick up that ability? Yes or no is the answer to the question on validity. The reliability of objective structured exams. In other words, there are two students, both of them have the same skill ability with respect to this task. Will they both get the same marks on an OSCE? Is the reliability. Objectivity, apart from his or her ability to record the ankle jerk response or record blood pressure, are there extraneous factors which come into the assessment of the student? That is the objectivity. Fairness, of course, you know all about students and how they feel after exams, and when they say, no, that was not fair. He asked me this and he asked me that, whereas for her, he only asked this. Fairness and the range of ability which can be tested. The ability to speak, to counsel, to take a history, to perform a procedure or a task, right? Now, this is just an example of an actual OSCE when we complete it. Let us say there are 4 students, student 1, student 2, 3, and 4, S1 to S4, and they were tested on 4 tasks. Let's call each task T1, T2, T3, and T4. Now look at this result of the OSCE exam. Let's understand this table. These are the 4 tasks on the column: a history taking, a response task, a procedure task, and a communication task. These were the 4 tasks. These are the 4 students on the rows: student 1, student 2, student 3, and student 4. So student 1, out of 20 marks for the history station, he got 14. In the response station, out of 20, he got 15. Procedure, he got 18 out of 20. Communication, he got 13 out of 20. This is student 2, this is student 3, and this is student 4. Now, when you look at this, when you look at the students' marks, S1, S2, S3, and S4, that's here, we can identify that student 2 got the maximum marks, and he was ranked 1 in this exercise. But I am drawing your attention to also these totals, the totals on the rows. And if you look at these totals, you find that the communication task got the lowest marks of all the 4 tasks. Now, does that tell us something? Does that tell us that we need to emphasize our communication skill development in our students a little more? They seem to be doing pretty well on the response and the procedure station. But the moment it comes to talking to the patients, both in the history station and the communication station, we find that the marks are low. So perhaps we need to give more emphasis to our students on how they communicate to our patients, how they take a history, etc. This is just an example of the utility of an OSCE to us as examiners. I'm almost done. These are just the last few slides. What are the disadvantages of objective structured exams? Like I said, it involves a lot of planning. We have to take out the objectives, choose the one which we want to check. Among that, in that, we have to take out the practical part of it. And in that practical part, we have to choose a task. And then we have to prepare a checklist of that task. We have to get the material, preparation of answer key, and set up that entire station, right? Lots of planning required for an OSCE to be done well. And perhaps it tends to compartmentalize the skills tested rather than testing the entire range of skills at one sitting. Now, when we take a long case presentation, it gives us the ability to really test a lot of things. We can even ask the guy to demonstrate something. We can ask him, how did you take this history? We can ask him this, that, But when we look at a station, it just looks at one skill compartmentalized, so to speak. It requires time and effort on the part of the examiners because we have to assess each student at our station during the exam. And what I call the Murphy index, the number of things that can go wrong, is high. The simulated patient did not show up. The patient who was supposed to come from the medical ward, he suddenly had to go for an urgent X-ray. This material that we relied upon is not available. So many things that can go wrong may actually go wrong. But it's definitely worth thinking about at your department as something that you can also do for your students. And more importantly, I think a lot of universities are actually planning to implement the OSCE and the OSPE as part of their routine examination system in the practical or clinical exam. That's it, ladies and gentlemen. I've come to the end. This was the objective of the session. At the end of this session, I had hoped that all of you would be able to know, of course, the full meaning of the term OSCE, but more importantly, what exactly it is and how it is organized, and perhaps the strengths and weaknesses of the system. So with that, let me hand you back to the organizers, Dr. Logaraj and Dr. Sharmila, I think, and I'm open to questions.
So there are a few queries in the chat box, sir. Can I read it out?
Okay, let me see. Here we are. Number of assessors. I'm looking at one question. It says, how is the OSCE being conducted in our center? The number of assessors to avoid the subjectivity of a single assessor if the questions are leaked during the exam, as all students are not tested simultaneously. Apprehensions of the exam for the students attending an OSCE. Yes, I do see a couple of questions here and a couple of observations. Thank you, Dr. Bhuvana, I think. Thank you for your question and your observation. Yes, like I said, the number of assessors is high. What we do, madam, in our department is we use this OSCE to, at the end of a particular block posting that we have, which we call the Urban Orientation Program, where the students are, as part of that module, they are with us for 4 weeks. And in part of that 4 weeks, for 3 hours each day. Not the entire day, obviously. So for 3 hours each day, they are there with us for 4 weeks. They are first posting with us. And during that time, they are sent to the urban underprivileged area, visit families, and are given particular questions and tasks, nutritional assessments, this, that, and the other. But the focus is on the social determinants of health. That's the focus of that posting. So at the end of that posting, we conduct an OSCE exam for them, in addition to a theory exam as well, just as a sort of a formative assessment at the end of that particular module. We generally have about, I think, 10 stations, and we require about 5 assessors because we have about 4 or 5 response stations. So on that day, we unfortunately require a lot of hands on deck. to be assessors, to even have them as simulated patients. Subjectivity is an issue even with the OSCE. Absolutely right. I take your point. But the checklist tries to minimize that subjectivity. That's all I can say. Because after all, there are almost 10 subcomponents, and to be subjective in all of them might be a little difficult. So it reduces but does not completely eliminate subjectivity. Questions are leaked during the exam. Yes. Now, what we do is for a given batch of, let's say, 20 students, we take 20 of them, 10 of them for the OSCE and 10 of them for an MCQ component, and then interchange the two batches after a given time. And we start all 10 of the OSCE students at the same time. We don't start them, each one of them with station 1 and end up with station 10, just like the spotters, I would guess. So yes, it depends upon also a little bit of segregation and trying to keep the confidentiality. Apprehension, of course. I guess it's good to speak to the students beforehand and say, look, we are going to do this kind of an exam for you. Don't be scared. It's just a series of stations. Enjoy it, have some fun, and let's see how you do. So this is how we handle this, Dr. Bhuwana. Thank you for your question. Now let's look at the other ones. Let's see. Yeah, okay, here we go. Is it required for pre-exposure of OSCE stations for students before the university exam? I think Dr. Saravanan, thank you for your question. Pre-exposure of OSCE stations, that's what we are trying to do. We're trying to introduce them to the system during the UG time. It hasn't yet come into our university, the Rajiv Gandhi University exams here, but they're threatening to introduce it at any point. So I do guess that a little exposure to the system beforehand is good. But the stations itself, just before the exam, I don't think we encourage exposing the students to the stations before the exam. No, we don't. We, in fact, like I answered in the previous question, we have a chat with them talking about what is an OSCE and what you will be going through when you go through the exam for about 15 to 20 minutes and then start the OSCE. And I think that should do. Yes, I don't see any other questions. Dr. Sharmila, back to you.
Yes, sir. There is one more query, sir. They have posted now. Can checklist be provided beforehand to the students?
Oh, yeah. Can the checklist be provided beforehand? Well, if you do that, that is like giving the sort of answer key to the students beforehand. I wouldn't recommend that. I would recommend that it's really a question of whether the student's able to do all those things in the checklist, and if the student's educational input has been adequate during the course, I think he or she should be able to address these stations quite well. Now, I'll tell you a simple example. We have a station, for example, where we say that this is a health worker. There is a simulated person sitting there. We say this is a health worker, and that health worker has received a child aged 2 at the health center. You are not at the health center. You are at the medical college, but the health worker has called you up and is asking you for guidance as to what is the assessment and classification of this child's illness for respiratory infection. So the module that we refer to is the acute respiratory infection assessment and classification checklist. So now the student has got to ask questions to that health worker, and by doing that should be able to come to a conclusion as to how to assess and classify that child which the health worker has received. I know it sounds a little complex when I say it to the computer like this, but the instructions are fairly clear. And I find that many students actually pick it up pretty well. And they ask, what's the age of the of the child? What are the symptoms? Then have you checked the respiratory rate of the child? What is the respiratory rate? Okay. Have you checked for the presence of other signs? For example, chest indrawing. Is it present? Yes, no. You'd be surprised, but some of them really go into the depths of how to assess and classify and actually come up with a good assessment and classification. So it's possible. I've seen both ends of the spectrum, students who are not able to do it and students who do it pretty well. But I guess it's a question of familiarizing them with it. I think that if we make an effort, we can do it. We can familiarize them with it as well. Yes. Anything else?